I need to tell you something that's going to make you angry. For the past 15 years, you've been lied to. Not by me, by an industry that profits from your confusion, by doctors who don't know what they don't know, by supplement companies that care more about sales than your actual health. My name is Dr. Morrison, and 3 years ago I watched one of my patients nearly die in my examination room because I missed something so obvious, so fundamental, so absurdly simple that I couldn't sleep for weeks afterward. Her name was Margaret, 68 years old, former marathon runner. Took her vitamins every single day for 15 years, did everything right. And her body was literally falling apart from the inside. Bleeding gums, bruises covering her arms like she'd been beaten, exhaustion so severe she could barely get out of bed, wounds that wouldn't heal, infections that wouldn't stop. When I finally ran the right test, the one test that nobody ever orders, her levels were so catastrophically low that the lab called me twice to confirm the results. She was dying, slowly, painfully, from a deficiency that costs less than $3 a month to fix. I'm talking about vitamin C. And before you click away thinking you already know about vitamin C, stop. Because what you think you know is probably wrong. You've been taking it wrong, timing it wrong, buying the wrong form, combining it with things that destroy its effectiveness. And nobody told you, not your doctor, not the label on the bottle, nobody. The pharmaceutical industry doesn't want you to know what I'm about to share, because if you did, you'd stop buying half the medications in your cabinet. You'd stop accepting normal aging as an excuse for falling apart. You'd realize that the exhaustion, the pain, the brain fog, the infections, most of it is preventable. Margaret transformed her health in 6 months with 3 simple changes, not medications, not expensive treatments, just 3 specific adjustments to how she took vitamin C. And by the end of this video, you'll know exactly what those 3 changes are. But first, I need to tell you about the mistake that almost killed her, and why you're probably making the same mistake right now. I'll never forget the day Margaret collapsed in my examination room. Tuesday afternoon, 3 p.m. What should have been a routine follow-up? Margaret had been my patient for 3 years, every 6 months. Blood pressure slightly elevated, cholesterol manageable, weight stable. On paper, she looked fine, but that day was different. Her skin had this dull, grayish quality. Her arms were covered in bruises, purple, yellow, green at different stages of healing. Margaret, have you been falling? No, Dr. Morrison. They just appear. I barely touch something, and the next day it looks like I've been in a car accident. I'd asked before, multiple times, but this time I really looked. Then she smiled, her gums, swollen, inflamed, bleeding. Are you flossing? Every single day, morning and night. I believed her. Margaret was obsessive about health. Pill organizer labeled by day and time, tracked her walks, meal prepped religiously. So I ordered tests, comprehensive panel, liver, thyroid, blood count, clotting factors. Thinking blood disorders, autoimmune conditions, maybe leukemia. Everything normal, except one number. Vitamin C level, 0.2 milligrams per deciliter. Normal range, 0.6 to 2.0. Critically deficient, bordering on scurvy, the disease that killed sailors centuries ago. I called her back the next week. Margaret, when did you last take vitamin C? This morning. Same as every morning for 15 years. 1,000 milligrams. Right after breakfast. I never miss. That's when it hit me. She was taking it, just not absorbing it. Here's what nobody tells you. Vitamin C is water-soluble. Your body uses what it needs immediately and flushes the rest within 2 to 3 hours. When Margaret took 1,000 milligrams every morning, her body absorbed maybe 200 to 300 milligrams. The rest, 700 to 800 milligrams, went straight into the toilet. For the remaining 22 hours, her cells starved. I explained this, watched her face change. So I've been taking it faithfully for 15 years, and my body's been starving? Yes. Silence. Then tears. My husband died 2 years ago. Heart attack at 70. He took his vitamins every day. Fish oil, vitamin D, CoQ10, multivitamins. He did everything right. I wasn't his doctor. But research shows people with higher blood vitamin C have 42% lower cardiovascular disease risk. Not people who take supplements, people whose blood contains adequate levels throughout the day. Massive difference. Margaret's husband probably swallowed 1,000 milligrams every morning. But if his levels were low 22 hours daily, his arteries aged faster, vessels damaged, heart struggling. Nobody told him. Nobody told Margaret. I started seeing it everywhere. A 63-year-old who lost 4 teeth despite perfect hygiene. Vitamin C, 0.3 milligrams per deciliter. Gums disintegrating. Couldn't make collagen. A 72-year-old whose cuts took weeks to heal. Vitamin C, 0.4 milligrams per deciliter. Cells couldn't repair without the essential nutrient. These people did everything right. But nobody told them the truth. Vitamin C isn't about how much you take. It's about when, how, and what your blood levels look like hour by hour. Margaret asked the question that changed everything. How do I fix this? That's when I told her about 3 simple changes that would transform her health. But first, you need to understand what happened inside her body during those 15 years. Because if you're taking vitamin C like Margaret, the same breakdown is happening inside you right now. I've been practicing medicine for over 2 decades. The hardest part isn't diagnosing disease. It's realizing you could have prevented years of suffering if you'd just known what to look for. Margaret's case kept me up at night. Not because it was complicated, because it was so simple. Let me show you what was happening inside her body during those 15 years. Every cell in your body is under constant attack. Not from viruses, from oxygen. Yes, the same oxygen keeping you alive is slowly destroying you. Every breath, every bite of food metabolized creates free radicals. Tiny sparks flying off a fire. This is oxidative stress, the root cause of everything we call aging. Wrinkled skin, stiff arteries, foggy memory, chronic inflammation. Vitamin C is your fire extinguisher. It grabs free radicals and neutralizes them. But only if it's present in your bloodstream. When Margaret took 1,000 milligrams every morning, her levels spiked for 2 hours. During that window, cells could fight back. Repair damage. Build collagen. Support immunity. Then it plummeted. By lunchtime, barely detectable. While she slept, when her body should repair itself, her cells had nothing. So what happened? Her blood vessels started cracking. Tiny microfractures in arterial walls. Without vitamin C, her body couldn't produce collagen to patch them. When arterial walls can't repair, cholesterol rushes in to patch holes. Over time, those patches build up, harden, narrow the arteries. We call it atherosclerosis. Research from the Linus Pauling Institute shows chronic vitamin C deficiency is a major factor. People with levels below 0.4 milligrams per deciliter have nearly double the heart disease risk compared to those above 1.0 milligrams per deciliter. Margaret's was 0.2 milligrams per deciliter. For 15 years. Her skin deteriorated from inside out. Collagen is everything. Holds skin firm, keeps joints flexible, gives bones strength. Your body constantly makes new collagen, replacing old damaged fibers. But only if vitamin C is present. Without it, the assembly line shuts down. Day by day, Margaret's collagen broke down faster than replacement. Skin lost elasticity. Lines deepened. Blood vessels became fragile. Why she bruised so easily. The slightest bump ruptured delicate capillaries. Her gums were the clearest warning. I missed it for 3 years. Gum tissue is almost entirely collagen. When you can't make new collagen, gums literally fall apart. Pull away from teeth, bleed, become infected. Dentists treat this as periodontal disease, scrape plaque, prescribe rinses, lecture about flossing. But if the cause is vitamin C deficiency, nothing works. Her immune system was failing too. Margaret caught every cold. Every flu season knocked her down for weeks. Here's why. White blood cells contain vitamin C concentrations 80 times higher than blood plasma. They need it to function. When they detect infection, they burn through reserves in hours. No vitamin C to replenish? Immune response collapses. You get sicker, stay sick longer. A 2017 nutrient study found people with adequate vitamin C had 18% fewer respiratory infections and recovered 31% faster. Margaret's chronic illness wasn't bad luck. It was biochemistry. Then the neurological effects. Margaret complained about memory problems, forgetting words, losing track of thoughts. I dismissed it as normal aging. But your brain is vulnerable to oxidative stress. It consumes 20% of your oxygen despite being 2% of body weight. All that activity generates massive free radicals. Vitamin C is one of few antioxidants crossing the blood-brain barrier. It protects neurons. When levels are chronically low, neurons deteriorate. Connections weaken. Oregon Health and Science University research found older adults with higher vitamin C performed significantly better on cognitive tests and had larger brain volumes on MRI. The difference? Equivalent to being several years younger neurologically. Margaret's brain operated in chronic stress for 15 years. I explained all this, showed her research papers, charts, collagen breakdown images. She listened quietly, then said something that broke my heart. Dr. Morrison, I've been so tired for so long. I thought this was just getting old. I thought the bruising, bleeding gums, brain fog, I thought that was normal. It's not normal, I told her. It's common, but not normal. And it's fixable. Fixing it required rethinking how she approached vitamin C. Standard advice is useless. Take a multivitamin. Maybe add vitamin C if you're run down. 1 dose, once daily. That fails because it ignores how your body works. Your body can't stockpile vitamin C. It needs continuous supply throughout the day. I showed her a graph. Blood levels over 24 hours. Once daily dosing, sharp spike, long trough, 3 times daily, steady levels all day. The difference in cellular exposure is staggering. Split dosing can triple the time cells have access to adequate vitamin C. So 3 times a day? Margaret asked. Yes, but that's not the only change. I was about to explain the other 2 critical factors when she interrupted. Before you tell me what to do, why didn't you catch this sooner? Why didn't any doctor catch this? Fair question. And the answer made me angrier than I wanted to admit. Margaret's question hung in the air. Why didn't I catch this sooner? I gave her the honest answer. Because we're not trained to look for it. In medical school, we learn about scurvy in 1 lecture. It's presented as historical curiosity, sailors centuries ago. We're taught it's extinct in developed countries. I paused. But that's not true. Subclinical vitamin C deficiency is rampant, especially over 50. We miss it because we're not testing. Here's the secret. We test for what insurance pays for. Vitamin C isn't routine blood work, not in annual physicals. Doctors only order it with obvious scurvy symptoms. By then, you've been deficient for years. A 2004 CDC study of 7,000 American adults found 7.1% deficient, 13.7% depleted. 1 in 5 adults with inadequate vitamin C smokers, nearly 30%. People not eating daily fruits and vegetables, 25%. Regular Americans, with grocery stores, taking multivitamins, doing everything right. Margaret was one of them. Even when we test, we use wrong ranges. Labs report normal as 0.6 to 2.0 milligrams per deciliter. But NIH research suggests optimal is 1.0 to 2.0 milligrams per deciliter. Margaret's 0.2 wasn't just low, it was catastrophic. So what now? She asked. What are the 3 changes? I wrote them down. First, split your dose. 500 milligrams after breakfast, 500 after lunch, 500 after dinner, 1,500 milligrams total, spread out for stable blood levels. Second, switch to liposomal vitamin C. Vitamin C wrapped in tiny fat bubbles, protective coating that helps it absorb efficiently. Regular vitamin C absorption drops with dose size. Take 200 milligrams, absorb 90%. Take 1,000 milligrams, absorb maybe 50%. Liposomal bypasses that. Fat coating passes through cell membranes easily. Studies show 90% absorption rates. Stays in bloodstream 6 hours instead of 2. It costs more, maybe 3 times regular price. But you absorb what you pay for. I don't care about cost. I want to feel better. Third, what you eat with it matters. Iron and vitamin C work together. Vitamin C increases iron absorption up to 300%. Pair them if taking iron or eating iron-rich foods. Collagen peptides are great too. Your body needs vitamin C to synthesize collagen, plus raw amino acids to build from. Together, you provide blueprint and materials. But caffeine is a problem. Coffee, tea, energy drinks increase kidney filtration, flush vitamin C faster. Wait 1 hour after vitamin C before caffeine. Calcium supplements interfere too. Separate from vitamin C by 2 hours to avoid absorption issues and kidney stone risk. What about food? Absolutely eat fruits and vegetables, but you can't fix severe deficiency with diet alone, not quickly. Orange, 70 milligrams. Strawberries, 90 milligrams. Bell pepper, 150 milligrams. For 1,500 milligrams daily, you'd need massive quantities. Plus, cooking destroys vitamin C. Boiling reduces content 50% or more. Eat produce for fiber, phytonutrients, synergistic vitamins. But supplement for deficiency recovery. How long before I feel better? Probably within a week. Energy improves, sleep better, brain fog lifts. A 2012 nutrition study found correcting deficiency. Improved fatigue 38% within 7 days. 2 to 4 weeks. Skin improvements. Faster healing. Less bruising. Healthier gums. Collagen synthesis ramps up fast, but visible accumulation takes weeks. After 2 to 3 months, we retest. Goal, above 1.0 milligrams per deciliter. Margaret processed everything, then asked something unexpected. How many other patients have this and don't know? I thought about hundreds of patients over 50, most taking vitamin C or multivitamins, most complaining about fatigue, slow healing, infections, joint pain. Honestly, probably most of them. That moment changed me. I started testing vitamin C routinely. Everyone over 50. Results were staggering. First 50 patients, 23 deficient or depleted, nearly half. People who ate well, took supplements, thought they were healthy. All shared a pattern. Taking vitamin C once daily, usually morning, usually with coffee. I implemented the 3-part approach with all of them: split dosing, liposomal formulation, strategic timing. Results remarkable. Years of exhaustion vanished. Chronic infections cleared. Gum disease stabilized. People looked younger. Skin improved. Lines softened. Dark circles faded. Margaret's transformation was most dramatic. 6 weeks later, follow-up appointment. I almost didn't recognize her. Gray pallor gone. Color in cheeks. Bright eyes. Bruises faded. Dr. Morrison, I feel like myself again. First time in so long I actually feel alive. Blood test results. 1.3 milligrams per deciliter. Not just normal, optimal. That's when she told me the story that made me realize this was about more than vitamins. 6 months later, Margaret came to my office without an appointment. I walked out expecting bad news. Instead, she was glowing. Dr. Morrison, I need to tell you what happened this weekend. She'd gone hiking, not her usual flat walk, Actual mountain hiking with her daughter and grandkids. 4 hours, 1,200 feet elevation. A year ago, I couldn't have done that. Saturday, I made it to the top. At the summit, her daughter pulled her aside. Mom, you look 10 years younger. What's your secret? Margaret explained the vitamin C approach. Her daughter listened, then said something that made Margaret cry. I wish Dad had known about this. Margaret's husband died of a heart attack 2 years earlier. He'd taken vitamins faithfully, fish oil, CoQ10, vitamin D, multivitamin with vitamin C, but taking vitamin C wrong, 1 dose mornings with coffee. What if his vitamin C levels had been optimal? Would his arteries have been healthier? I couldn't say it would have saved him, but research shows people with higher blood vitamin C have 42% lower heart disease risk. Not people who take supplements. People whose blood contains adequate levels all day. The Rotterdam study followed 5,000 adults for a decade. People with highest vitamin C intake had 25% lower heart disease risk, but only if blood levels stayed consistently elevated. Sporadic high doses didn't help. Steady levels did. Margaret was determined others wouldn't wonder the same about loved ones. She started talking to everyone. Book club, church, neighbors. Within 3 months, 15 new patients came because Margaret sent them. All over 60, all taking vitamin C incorrectly, all suffering symptoms dismissed as normal aging. Everyone tested deficient or depleted. Robert, 71, chronic gum infections. Dentist recommended surgery, $12,000. Vitamin C, 0.3 milligrams per deciliter. Started split-dose liposomal. 8 weeks later, gums stopped bleeding. Dentist shocked. You might not need surgery. Sharon, 66, fallen 3 times past year. Massive bruising each time. All tests normal. Blamed on getting older. Vitamin C, 0.4 milligrams per deciliter. Fragile blood vessels. 6 weeks later, bumped table hard. No bruise appeared. I'd forgotten what it felt like to not be covered in bruises. James, 68, recurrent respiratory infections 3 years, bronchitis, sinus infections, pneumonia twice, vitamin C 0.25 milligrams per deciliter. We fixed his levels. That winter, didn't get sick once. Life-changing. Most powerful story, Margaret's daughter Jennifer, age 45, relatively healthy, but run down for a year, tired constantly, getting sick frequently. I want testing. If my parents were deficient, I need to know. Vitamin C, 0.5 milligrams per deciliter. Suboptimal. She'd been taking multivitamin with 60 milligrams vitamin C, barely enough to prevent scurvy. Started the approach for prevention. 6 weeks later, she emailed. I didn't realize how bad I felt until I started feeling good. Energy back. Skin clearer. Not getting every cold my kids bring home. I thought this was just life in your 40s. That's when I realized. We've normalized dysfunction. We've accepted that aging means tired, bruising easily, healing slowly, getting sick often. But what if significant normal aging is actually chronic nutrient deficiency? A 2018 study found people with optimal vitamin C had cellular aging markers consistent with being 5 to 7 years younger, 5 to 7 years at the cellular level. Margaret experienced both. 15 years accelerated aging, then 6 months reversal. 8 months into treatment, she asked, why isn't this common knowledge? Why aren't doctors teaching every patient over 50? Same answer. Not trained, not standard care. Insurance doesn't cover testing. Then we need to change the standard. She was right. That conversation led to this video. I'm one doctor. I can help my patients. But millions suffer needlessly because they don't know what you're learning now. Now let me explain the relationships that make this work. People don't change because of data. They change because of relationships. Margaret transformed because she trusted me. After she got better, she became an advocate. Not to sell supplements, but because she'd been given a second chance. That's what I'm talking about. The relationship between knowledge and action, between understanding your body and caring for it, between you and people you love who need this. Over the following year, Margaret's story spread. I went from 1 or 2 vitamin C cases monthly to 5 or 6 weekly. With each patient, I learned. Refined the approach. What I'm sharing is treating over 200 patients. This isn't theory. This works in real people. First, the relationship between vitamin C and iron. Iron makes hemoglobin, oxygen-carrying protein in red blood cells. But iron is difficult to absorb, especially from plant foods and supplements. Vitamin C changes that. When taken together, vitamin C converts iron into easily absorbed form. Studies show 200% to 300% absorption increase. Linda, 64, anemic for years despite taking iron religiously. Doctor kept increasing dose. Hemoglobin barely budged. Up to 150 milligrams daily, still barely normal. Vitamin C, 0.4 milligrams per deciliter. Started split-dose liposomal with iron. 6 weeks later, hemoglobin jumped from 11.2 to 13.8 grams per deciliter. Fatigue disappeared. That's understanding nutrient relationships. Second, vitamin C and collagen. Your body makes collagen from amino acids, glycine, proline, lysine. But synthesis requires vitamin C. Without it, collagen molecules don't form correctly. Weak, unstable, prone to breaking. Subclinical deficiency causes subclinical collagen defects. Skin ages faster, joints ache, wounds heal slower. I recommend taking collagen peptides evening with nighttime vitamin C. Your body does most repair while sleeping. Give it both building blocks and assembly instructions simultaneously. Patients reported skin improvements within 4 to 6 weeks. Joint pain decreased. One patient's chronic tennis elbow, 2 years of pain, vanished after 3 months. Third, vitamin C and stress. Adrenal glands producing stress hormones have highest vitamin C concentrations in your body. Under stress, they burn through it rapidly. Chronic stress depletes vitamin C. Depletion makes you less able to handle stress. Vicious cycle. Thomas, 59, brutal divorce, high conflict legal battle, crushing fatigue, brain fog, constantly sick. Vitamin C, 0.3 milligrams per deciliter. Stress draining it from his system. Bumped dose to 2,000 milligrams daily, 4 doses. 3 weeks later, I'm dealing with same nightmare, but I can handle it. Not getting sick. Brain works. Adequate vitamin C helps regulate cortisol and supports neurotransmitters. Doesn't eliminate stress, gives your body resources to cope. Fourth, vitamin C and medications. Certain drugs deplete vitamin C. Aspirin increases urinary excretion. Oral contraceptives lower blood levels. Corticosteroids accelerate metabolism. Antacids interfere with absorption. If you're on these, you need significantly more vitamin C. Patient on low-dose aspirin for cardiovascular protection. Common over 60. Vitamin C, 0.4 milligrams per deciliter despite multivitamin. Increased intake to compensate. Levels normalized. Aspirin seemed to work better. Research suggests vitamin C enhances aspirin's benefits while reducing side effects. Fifth, vitamin C and long-term health. A 2015 meta-analysis found people with highest vitamin C blood levels had significantly lower rates of various health issues. Vitamin C protects DNA from oxidative damage, enhances immune surveillance, supports collagen production. Data suggests maintaining optimal levels throughout life may reduce various risks. Earlier you start, better the outcome. Most important relationship, you and your body. Most people treat bodies like cars they're trading in. Push hard, ignore warnings, skip maintenance. But you don't get to trade in. This is the only one you get. Every day operating with suboptimal nutrients, you're accumulating damage that may not be reversible. Margaret understood after transformation. paid attention to signals she'd ignored. Fatigue wasn't normal aging, it was information. Slow healing wasn't inevitable, it was warning. When you optimize vitamin C, you're not just preventing deficiency, you're giving every cell tools to function at its best. Investing in resilience, longevity, quality of life. I've seen patients in 70s regain energy from their 50s. Chronic issues resolve. People look younger, not from procedures, but because skin produces healthy collagen. But none of this matters if you don't implement it. Here's my challenge. Next 30 days, commit to the approach. Split dosing, liposomal formulation, strategic timing, proper combinations. Track how you feel. Take notes. Pay attention to energy, skin, recovery, susceptibility to infections. After 30 days, assess. If it made a difference, keep going. Make it permanent. Tell people you care about. If it didn't, at least you know. You tried something evidence-based, but give it a real chance. Don't take doses sporadically. Don't skip days. Don't take with coffee or in ways sabotaging absorption. Do it right for 30 days. Then judge. Because when you give your body what it needs, it responds. Sometimes dramatically, sometimes subtly, but it responds. Your cells want to work properly. Your immune system wants to protect. Your vessels want flexibility. Your skin wants repair. Your brain wants clarity. They just need raw materials. Vitamin C is one of the most fundamental. So let's get to practical details. Exactly what to buy, when to take it, how to optimize absorption, what results to expect. Let's get specific. Just the exact approach I've used with over 200 patients. 5 components: dosing, formulation, timing, combinations, what to avoid. Component 1. Dosing standard recommendation. 500 to 1,000 milligrams once daily is inadequate. For general health, consider 500 milligrams 3 times daily. Breakfast, lunch, dinner. Total, 1,500 milligrams. Why 500 milligrams? NIH research shows this is maximum efficiently absorbed per dose with liposomal formulations. If dealing with deficiency, stress, or smoking, consider 500 milligrams 4 times daily. Total, 2,000 milligrams. Critical, maintain consistently. Can't skip days. Your body doesn't store vitamin C. Component 2. Formulation. Standard ascorbic acid. Cheapest. Absorption drops significantly above 200 milligrams doses. Can cause stomach upset. Liposomal vitamin C. Game changer. Encapsulated in phospholipid spheres. Passes through intestinal wall efficiently. A 2016 study. Liposomal resulted in blood levels twice as high. Stayed in circulation 6 hours versus 2 to 3. Recommendation. Use liposomal for at least 2 daily doses, especially evening. If budget concerns, use regular for 1 daytime dose. Comes in liquid or gel packets. Requires refrigeration. Component 3. Timing. Dose 1. After breakfast. Wait 1 hour before coffee. Caffeine flushes vitamin C faster. Dose 2. After lunch. Good timing if taking iron. Enhances absorption. Dose 3. 30 to 60 minutes before bed. Most important. Body repairs while sleeping. If 4 doses, add mid-afternoon around 3 to 4 p.m. Important. If taking calcium, separate from vitamin C by 2 hours. Component 4. Combinations. Vitamin C plus iron. Research shows 200 to 300% absorption improvement. Vitamin C plus collagen peptides. Take 5 to 10 grams collagen with evening vitamin C. Patients report skin improvements within 4 to 6 weeks. Vitamin C plus vitamin E. Work synergistically. Vitamin C regenerates vitamin E. Component 5. Avoid coffee and tea. Wait 1 hour after vitamin C before caffeine. Alcohol depletes vitamin C rapidly. If drinking regularly, may need 2,000 milligrams daily. High-dose calcium, separate by 2 hours. Avoid kidney stone risk. Antacids reduce absorption. If on these long-term, use liposomal form exclusively. Timeline. Week 1, improved energy, better sleep. Weeks 2 to 4, skin improvements, faster healing, less bruising. Weeks 4 to 8, more significant changes, skin tone evens out, fine lines may soften. 3 months and beyond, better cardiovascular function, improved cognitive clarity, enhanced stress resilience, only happens with consistency. Testing. Ideally, test before starting and after 2 to 3 months. Request plasma, vitamin C test. Not routine blood work. Out of pocket typically $50 to $150. Target 1.0 to 2.0 milligrams per deciliter. Below 0.6 is deficient. Between 0.6 and 1.0 is suboptimal. If can't test, implement and observe how you feel. Summary. Split dosing. 500 milligrams 3 to 4 times daily. Liposomal when possible. Strategic timing. After meals, away from caffeine, before bed. Smart combinations. Avoid interfering substances. Not complicated. Not expensive. $40 to $60 monthly. Doesn't require prescription, though work with healthcare provider if you have conditions. Requires consistency. 30 days minimum. 3 months to assess impact. Margaret started 2 years ago. Level now 1.3 to 1.5 milligrams per deciliter. She's 70, looks 60. More energy than most half her age. No serious infection 2 years. Skin glows. Mind sharp. All because of vitamin C? No. She eats well, exercises, manages stress. But vitamin C is the foundation supporting everything else. And it may do the same for you. Starting today. The world's cheapest supernutrient. Most overlooked, most misunderstood, most improperly used vitamin. You now know how to use it correctly. If you found this video helpful today, please show your support with a like and subscribe. And in the comments, I'd love to hear about your own vitamin C routine. Your single comment could be the beginning of someone else's journey to better health. Until next time, this is Dr. Morrison, looking out for your health